This is Tanisha and Lawrence. I am a licensed life and health insurance producer. I am a wife, a mother, a caregiver, and also an educator on health and wellness. Now, I just want to shoot this video. I know a lot of people that are enrolling in the health insurance, the Affordable Care Act, or through a private insurance company. So you're asking yourself, this is your first time having health insurance, and you really don't know what to choose. Um, before I was licensed for a life and health insurance producer, I worked in the healthcare industry with a big company, a health insurance company. So I learned a lot of benefits and claims and what people choose. Some people choose plans without even really understanding what they enroll in, really understanding the deductible, the premiums, the co-insurance, the co-pays, and don't know what is a deductible. So just be mindful and careful and look at your plan, even with the Affordable Care Act, with the Obamacare, or with the private insurance companies. Also, did you know that there's a thing called short-term medical plans, meaning depending on what state you're in, it varies in states. Some states, like the state of Florida, you're able to get a plan up to 11 months. It is a temporary plan. It's for those who are in between jobs or near retirement, don't want to go on Cobra because Cobra has high premiums, or those that don't qualify for the Affordable Care Act, or because you're not working, or that the premiums are very high. It doesn't protect you from the tax credit. So just be mindful that it is a short-term medical plan. However, it's different companies have them. You can go to Tanisha and Lawrence .com, where you can look at the different plans and also get education, get information on about the different plans that I'm speaking of. So again, look at your plans, compare them. If you're a healthy individual, um, you want to just check on the copays. So say you're thinking I'm a healthy individual and I don't really need a Cadillac plan. So let me get this high deductible insurance because the premium is low. But what if you have to put all that in factor? What if you need that insurance? Because, like I said, I used to work for uh, a large insurance company, and people did not know that they needed their health insurance at a point of time, and they chose this high deductible plan. Sometimes the deductible of $5,000, $10,000, where they chose a plan where if you go to a doctor or a hospital, you will have to meet some of that deductible, not all of it. When it says deductible, the deductible mean is that is something that you will have to pay before the insurance company help you pay. Coinsurance is a bill that you and the insurance company share. It's a shared cost. So, say if you have a plan that has a $5,000 deductible and a 20% coinsurance. So, what that means, depending on what your plan looks like, because a plan can be when you go to a doctor, a primary care doctor, or a specialist doctor, you would just have to pay a $25 copay or a $45 copay. These are examples. I'm not speaking of any particular plan, so these are examples. Um, Say if you have a primary care doctor copay of $25. Well, the $25, that is what you will have to pay if that's how your plan reads. You will not have to meet a deductible. So if the bill is $100 for the primary care doctor, that's the allowed contract rate that this doctor has discussed with your insurance company and stated that you cannot bill my member more than what the allowed contract rate is. And that is um, the allowed contract rate is $100, but your plan reads you only pay $25 of it, of that copay, and then the insurance company pays $75. That example, you will not have to meet a deductible or a co-insurance because your plan reads straight copay. It doesn't read deductible plus co-insurance on your office service. So it's very important that you educate what type of plan you have and not just hurry up and rush so you won't miss the enrollment date. So again, if you have a high deductible, it doesn't necessarily mean that that is a bad thing. The reason why I say that is because you may have a high deductible on hospital, inpatient, outpatient, ambulatory surgical centers services. Those ambulatory surgical centers are outpatient centers where they do like colonoscopies, endoscopies, outpatient services where you don't have to stay overnight. And a lot of doctors own those surgical centers. But be careful because there are some hospitals have bought different ambulatory surgical centers. And I won't put everything on this video, but I will do little snippets and pieces on how your benefit works. Again, even though I am a life and health insurance producer and I do educate and I am licensed to sell life and health insurance and supplemental insurance, I am an educator first. And the reason why I say that is because, like I said, I am a wife, a mom, and a caregiver. And I am a caregiver to my mom. And the reason why I put education first is because a lot of people do not understand their plan. A lot of people do not understand what they enroll. If my mom had to navigate through her journey by herself, it would have been so confusing to her because she's not in the healthcare industry. Because a lot of people enroll or they're not educated enough on what type of plan they enroll in. And I'm not just an insurance producer, I am an educator, I am a teacher. I help you understand what you have. Yes, it may take a longer time because you're not in the industry, but I break the pieces and examples down for to bring it to you where you can understand what you have. Where you can walk away and say, okay, I understand. If you don't understand the whole overall, but you understand the basic and the foundation on what you have and how insurance works. It doesn't matter what plan you choose. It does, but it doesn't matter if you choose the Cadillac, if you choose the lower plan, or if you choose this plan, if you have subsidy with the Affordable Care Act. What matter is that you understand your plan. That what matter is you understand what you're paying for. And that's very important because you could get in a plan and you may need it right away and you may not have the money to pay the copay, or you may have chose a plan that when you go to an office or urgent care center you have to meet a deductible, and your deductible is $10,000. You may have a $900 deductible, you may have a $250 deductible, but I don't know. These are examples, only you know, or you can help me help you understand how your plan works. Does that make any sense? So, again, my name is Tanisha in Lawrence, and you can check me out for more information at tanishainlawrence.com. I am a licensed life and health insurance producer. I'm also a wife, a mom, and a caregiver, and an educator on health and wellness. If you like this video, comment below. give me feedback. You know, I'm open to feedback. And also comment on any questions that you want to ask me about health insurance, about life insurance, supplemental insurance, things you've been reading. What is your copays? What is deductible co-insurance? And I will start a forum on my website and answer these questions as I know. And if it's a broad question, I will also research it for you. I want to be an educator and a teacher and help you understand what you have. And I thank you for watching this video, and I hope you have a wonderful day.